Hi, I'm Dr. Roger Fonts, orthopedic surgeon in Southern Nevada. And in this talk, we're going to be reviewing what is arthritis. So, arthritis, as it's defined, is inflammation of a joint. So, arthro in Latin means joint, and itis means inflammation. So, within that term, catch-all for arthritis, there's dozens of different categories that can cause arthritis. The two principal things that I want to talk about that orthopedic surgeons treat is degenerative arthritis, which is also called osteoarthritis, and autoimmune arthritis. Examples of that would include rheumatoid arthritis, psoriatic arthritis, and lupus. Let's focus on degenerative or osteoarthritis. I have another video talking a little bit about the term osteoarthritis and how much I really detest the term, principally because it confuses people. Heck, it confuses me. I don't know why the word osteo is in the word osteoarthritis to begin with. Osteo refers to bone, and arthritis has nothing to do with bones. It's a disease of the joint. So in an effort to keep things simple, I'm going to try to use the term degenerative arthritis. The vast majority of patients that I see in my office have degenerative arthritis. It's a wear and tear phenomenon in which the cartilage breaks down over time. It makes sense that cartilage that's exposed to high stresses will break down sooner than others. So it's more common in the knees and hips and ankles. It's also surprisingly common in the thumb joint, the basilar joint, particularly in females. However, osteoarthritis can occur in any joint. It does occur in the shoulder occasionally, elbow, wrist, toes, midfoot, etc. The actual source, the initial event that triggers arthritis is usually not known. We do know there are risk factors though. It's associated with obesity. It's also associated with aging, which makes sense. The longer you live and the more stress you put on your cartilage, the more likely it is to wear out. Cartilage is in fact one of the most amazing biological materials there is. If you think about it, the average person walks somewhere between 1 and 3 million steps a year, and they may live for 80 to 85 years. And those cartilage surfaces are undergoing hundreds of millions of wear cycles. We have nothing that's man-made that would ever put up with that kind of stress. And in fact, most people go through their lives and don't get degenerative arthritis. I recently saw a study that showed that by the time you get to 80, about 25% of people have degenerative arthritis of the hips and about 50% in the knee. So it's not uncommon, but it's by no means a guarantee that as you get older, you will get degenerative arthritis. Let's talk a little bit about treatment. So there's no known cure for degenerative arthritis. And in fact, there's nothing that's been shown that will actually slow the progression of the disease, unfortunately. So we're left generally palliating the symptoms. I'll tell you, this is a frustrating thing for an orthopedic surgeon because I, like most of my colleagues, went into orthopedics because we like treating problems, eliminating the problem, solving the problem. And arthritis, in some ways, is one of the few things that we're not good at curing. If you think about it, in medicine, we don't cure a lot of things. We don't cure high blood pressure. We don't cure diabetes. We simply mask the symptoms or reverse some of the manifestations, but the underlying problem exists. And the same is true for arthritis. There's been a lot of research and billions of dollars spent trying to understand how cartilage gets damaged, what techniques we can use for trying to have it regrow, and how we can prevent the progression. I don't think we're anywhere close to having a solution for treating arthritis and reversing the degenerative process. So in the meantime, we're stuck with suppressing the symptoms, and if that doesn't work, replacing the joint. What we're using now for suppression of symptoms include, at its simplest, ice, which is surprisingly effective for many people. Compression bracing can help. Oral anti-inflammatories, non-steroidal anti-inflammatories like ibuprofen, naproxen, Voltaren, Celebrex, Mobic, those types of drugs can be very effective. Unfortunately, there's increasing evidence that non-steroidal anti-inflammatories are not super good for you in the long run. There are issues of gastric bleeding, and there may be issues with heart disease as well. Another treatment can be intra-articular injections of cortisone. It's generally very effective, and unfortunately it can only be done 3 times per year in the same joint to avoid accelerating the degenerative process. I think I'm going to cut this video at this point, and I'll do part 2 talking about the other aspect of arthritis that we treat, which is autoimmune arthritis. Thanks. And as always, if you've enjoyed this video, please subscribe to my YouTube channel. And again, remember, the best patient is an informed patient. Thanks for listening.